So we're not going to replace national measures with a free-for-all, the status quo anti-COVID. We're going to go back instead to a regional tiered approach, applying the toughest measures where COVID is most prevalent. And while the previous local tiers did cut the number and cut the R number, they were not quite enough to reduce it below 1. So the scientific advice, I'm afraid, is that as we come out, our tiers need to be made tougher. In particular, in Tier 1, people should work from home wherever possible. In Tier 2, alcohol may only be served in hospitality settings as part of a substantial meal. In Tier 3, indoor entertainment, hotels and other accommodation will have to close, along with all forms of hospitality except for delivery and takeaways. And I'm very sorry, obviously, for the unavoidable hardship that this will cause for business owners who've already endured so much disruption this year. Mr. Speaker, unlike the previous arrangements, tiers will now be a uniform set of rules. We've also, and that's to say we won't have negotiations on additional measures with each region. It's a uniform set of rules. And we've learnt from experience that there are some things we can do differently. So from the 10 p.m. closing time for hospitality, we're going to change that so that it is last orders at 10 with closing at 11. In tiers 1 and 2, spectator sports and business events will be free to resume inside and outside with capacity limits and social distancing, providing more consistency with indoor performances in theatres and concert halls. We'll also strengthen the enforcement ability of local authorities, including specially trained officers and new powers to close down premises that pose a risk to public health. Later this week, I should say, we will announce which areas will fall into which tier, I hope on Thursday, based on analysis of cases in all age groups, especially the over 60s, also looking at the rate by which cases are rising or falling, the percentage of those tested in a local population who have COVID, and the current and projected pressures on the NHS. I'm sorry to say we expect that more regions will fall, at least temporarily, into higher levels than before. But by using these tougher tiers and by using rapid turnaround tests on an ever greater scale to drive R below 1 and keep it there, it should be possible for areas to move down the tiering scale to lower levels of restrictions. By maintaining the pressure on the virus, we can also enable people to see more of their family and friends over Christmas. Mr. Speaker, I can't say that Christmas will be normal this year, but in a period of adversity, time spent with loved ones is even more precious for people of all faiths and none. We all want some kind of Christmas. We need it. We certainly feel we deserve it. But what we don't want is to throw caution to the winds and allow the virus to flare up again, forcing us all back into lockdown in January. So to allow families to come together while minimizing the risk, we're working with the devolved administrations on a special time-limited Christmas dispensation, embracing the whole of the United Kingdom and reflecting the ties of kinship across our islands.